love it. The calls.
You'll eventually get the 20% back. That Silver Connect card is going to pay her co-payments. Remicade, I believe, is an injectable, and her hospitalization co-payments. And tell them to turn his Part B on. All right. That's right. You know what that music means. It means Michael Regan. This is not Medicare and You today, although we always will take your Medicare questions. Why? Because the original show was called Medicare and You. This episode happens to be called Healthcare and You. The reason we changed that up is because I am so lucky today to have a colleague, and I do call him a friend. We've known each other quite a few years. Christopher Mele, M-E-L-E. He is one of the directors at Access Health, CT.com. Do not put in Access Health. It will actually spin you off to like a McKesson website. So we're going to make sure we do this properly. It's www.access, A-C-C-E-S-S, healthct.com. Christopher Mele is a good friend of mine. We knew each other at a big carrier out of North Haven. In its day, he was my rep. And I can tell you he's an athlete, he's a good man, he's a hard worker, and I'm very, very proud of him to see what he's done in making the transition over to the Connecticut Insurance Exchange. It's a marketplace, as you know. All right, we're going to have a Mattituck Minute. So you want to introduce yourself to our listeners, and then we'll do, this is Christopher Mele with Access Health CT.
Welcome. Yeah, thank you, Michael. Appreciate it.
My pleasure.
Yeah, I'm the broker marketing and sales manager for the State of Connecticut Health Insurance Exchange. I work with the independent insurance brokers who operate in the state, who are helping people with their individual insurance needs and small group needs. Really excited to be on the show. Hopefully I can shed some light on some of the questions people have and go through the process of applying to the exchange and how the tax credits work, and shed some light on some issues that have been rising up in the last couple weeks.
We know you're going to have questions on this. All of you people, you must have insurance no later than December 23rd to be approved for a January 1st, 2014 effective date. You know there will be a penalty, which I will allow Chris to go over. And we're going to have our Mattituck Minute because my friend Stephanie Harris has been patiently waiting. Steph, I sincerely apologize to make you wait.
No problem, Mike.
You know, I had to apologize to my buddy.
Understandable,
yeah,
no
totally.
problem.
All right. So I must say that I went to the guitar show.
Yes.
Last Thursday.
What did you think?
Rockin'.
Awesome.
I could not stop tapping my feet. Now, in Barcelona, when we went, there was actually dancers as well as the guitar players.
Okay.
And you go ahead. Tell us what that was, and then I'll elaborate a quick second.
Well, it's part of our First Thursday program, and we're expanding First Thursday. That was a flamenco ensemble led by Val Ramos.
Right.
And it's kind of gonna be morphing into different genres of music, and not just that jazz every month. So we're excited to see what people think of the new programming.
Oh, the flamenco ensemble was incredible. They had 3 or 4 guitar players, all individually. Larry Rifkin would have loved it because I know he's a musician. But they were riffing. It was all acoustic guitars. And they brought a little cheering section with them over to the right. My wife Diana is extremely beautiful, but I still do have eyes. There were some lovely ladies over to the right, flamenco dancers actually, and they were, shouting some words of encouragement. It was really incredible. And I confirm that room is blue, Stephanie. I saw that Munga room. It's blue, okay?
Very blue.
All right, so what's happening for our Mattituck Minute? What do we have on the agenda?
There's a couple things happening this week that I wanted to let your listeners know about.
Please do, Marketing Director.
First thing, we're doing, the museum has been working on a strategic plan for months and months, and we're finally ready to present that to the public tonight. Right. So we're really excited. It'll be tonight at 5:30 here at the museum, and we're going to go through and inform members and community members about the direction of the museum and where we see ourselves going and our goals and our vision for the future. So it's going to be really exciting, and that's tonight at 5:30.
And That's actually the strategic plan is basically our new, renewed mission, what we're going to go forward with. It's definitely something we want the community to come out and support.
Exactly.
Perfect timing on a Wednesday for the Wednesday evening.
Yeah, really, really good timing.
Right. So it's this evening at the Mattituck Museum,
Yep.
which is, as you know, right on the green, right next door to the YMCA. At 5:30. How long do you think that'll run?
It's scheduled to be about an hour and a half, but that includes, some Q&A and those kind of things at the end. So I think the presentation itself will probably be 45 minutes to an hour.
So 5:30 to about 6:30. If you're pressed for time, sure. 5:30 to 6:30 if you're pressed for time, but 5:30 to 7 would be optimum if you can make it down tonight.
Yeah, if you've got questions, if you're a member of the museum and you really want to,
Be part of it.
of what's going on, yeah.
Sure.
Exactly.
Okay, what else do we have? What's on the agenda for any new gallery openings?
So, but this week we have a couple more things, if you don't mind.
No, please. That's why you have it.
Tomorrow at 5:30, we're going to be showing a documentary on Alex Katz, which is the exhibition that we just opened last week on Sunday. Wonderful exhibition from the Whitney Gallery, Whitney Museum of American Art. And we're going to be showing the documentary. It's just under an hour about Alex Katz and the whole process that he went through to create a work called The Black Brook.
Okay.
It's a 32-foot painting that he did recently.
32 foot's quite a work.
Yeah, it's very large scale.
Kind of like the Jackson Pollock he did for the Guggenheim.
Yeah, it's extremely large. It's nothing that would fit in our building, but it's a really interesting documentary. It's cycling through here in the exhibition, but we're going to play it in its entirety tomorrow evening at 5:30. Tomorrow evening at
5:30. You know what? That's actually a good time to have functions starting now. Whoever thought of that was very smart for business people. Sometimes they used to start
we want you to be able to leave work and come over and get in a little bit of culture before you head home for dinner. So.
Right. So we've got the Alex Katz tomorrow night. We've got the strategic reveal tonight, the strategic plan.
Yeah.
Strategic
and then Sunday
plan.
We've got,
I gotta say, Seth Duke and Hiram Upson have championed it, and they've worked tirelessly. Kathy Smith, I know you've put in a lot of time on this, so thank you from the bottom of our heart. And the firm out of Hamden did a really excellent job on this.
They did, yeah. They really helped us focus and figure out, where we're going in the next 3 years.
Okay, Stephanie Harris, beautifully done. Anything else? Any last words?
I just want to say there's a concert on Sunday, holiday concert. So if you're in the mood to get into the holiday spirit, come on down at 3 o'clock. It's Michael Castaldo here at the
You got a full packed Mattituck Minute here.
We do.
Holiday concert at what time? 3:30?
3 o'clock.
3 o'clock
on Sunday.
On Sunday, and that's at the museum.
It is.
You've got the strategic plan this evening and the Alex Katz film tomorrow night. So if you can't make one of those, shame on you. We've been plugging the museum for years now. All right, Stephanie Harris, have a great afternoon.
All right. Thanks, Mike.
Thank
Bye.
you so much for your time. And as you know, I'm a very proud board member. That's why I do the Mattituck Minute. Let our listeners know. Usually when the show is Medicare and You, the seniors love it, but the community's out. All right, so this is Healthcare and You today. I had Jason Madrick, the Chief Marketing Officer, on, and Jason informed us that they were well ahead of the curve. And I must say that the exchange is very successful. It's working. I'm going to let my friend Christopher talk about that, but I can say a few things. Healthcare and You was established with the exchange in mind. The brokers that are enrolling you, my staff, I have to admit my staff is smarter than I am. I didn't really grow up that much of a techie. I grew up an athlete in Cheshire, and I was a good cum laude student, but not summa cum laude. So after a traumatic COBOL and Pascal classes, I took the VAX, VAX, the VAX system. This was in 1990. And I learned about programming. I sort of slacked off after that, and I should have kept up because the exchange is very Internet-based. There is a health fair tonight at St. Mary's Hospital from 4 o'clock to 8 o'clock. There will be assisters, navigators, and licensed insurance brokers there. They give us a 6-digit PIN, like a blank, blank, blank. Mine starts with 97.
Yeah.
But they give us a PIN, and if someone is assisting you, you put the broker's code in. For my clients out there, we're going to always help you with claims. I've just gotten off the phone with Victoria Veltri, our ombudsman, and she is actually saying to anyone that calls that's from Waterbury, just call G.S. Regan. So it's beautiful. Christopher, you've actually sent us quite a few leads yourself. Your Access Health CT has sent us leads. So thank you very much.
Yeah, absolutely.
All right, I'm going to say one more thing, and then I'm going to turn it over to Chris. You got 40 minutes, and we're going to have the phone lines open. Anyone with questions on accesshealthct.com, remember, you're going to have questions. It's not that easy. It's not as easy as buying a bike tire on eBay. It's actually quite, you need to know how to get the tax credit. You need to know your current income, 2012's income, and a projected 2014 income. You need to have in front of you all your children's Social Security numbers, dates of birth. The line 32 is the line number they're looking for. It's not line 1 on your tax return. It's line 32. So there's a difference between gross and net. One thing I would like to congratulate Christopher, Kevin, Jason, and Phil is the success. Connecticut is leading the United States of America, not just New England, the United States with the success of Access Health CT. The healthcare.gov has not worked as well. The reason for our success, the state of Connecticut, is due to Kevin Cunahan. Kevin came from Massachusetts, and under the Mitt Romney administration, Kevin actually built with himself and his own tech team the connector. So when the government looked at the exchange, they knew Connecticut was going to be one of the leaders. They went out and sought the guru, and they specifically hired him for Connecticut from, was he in California at that time when we got him, or was he still in Mass?
He was with the Commonwealth.
He was with
Yeah,
Commonwealth. Well done.
Massachusetts.
So he was at Mass. He had done such a great job with the connector, and now he is here up in Hartford at Trinity Street. But don't drive there. I'm going to turn it over to Christopher Melee, and he's going to tell you all about the exchange. We want to take your calls, please. 203-757-1320. Any questions you have on the exchange. Take it away.
Thanks, Michael.
My pleasure.
And I just want to say I really appreciate all the things that you've done for us and the people that you've helped. Back when I was at the insurance carriers, I would send a lot of leads to your agency. Your staff is very knowledgeable. I trust you to take care of my friends and our family, and we do appreciate that.
I really appreciate that comment. That was nice.
So, building on something you were talking about the penalties. It's important for people to understand.
Nice and slowly, remember. They got to get this.
Yeah, I understand. It's important for people to understand how it's going to work with regard to the tax penalties going forward. So for 2014, as you were talking about, it's a $95 penalty per person, or 1% of your annual income, and that's based on your modified adjusted gross income. And for 2015, the penalty will be $325 per person, or 2% of your income. And for 2016, it'll be $695 per person, or 2.5% of your annual income, whichever is greater.
And don't forget the $47.50 per child.
Correct.
Yeah.
Correct.
This kid's not a fly-by-nighter.
Yeah.
All right, talk.
So, with regard to the exchange, there's really no wrong door when it comes to getting into the exchange. The preferred method from our standpoint is to go through your local insurance broker. The local insurance brokers who've been doing health insurance for the past 20-something years are really great at what they do. They take a real interest in understanding the minutia of how this process works. They've been studying this for the past 3 years. Guys like Michael have been calling me day and night, trying to get more answers and more answers, even when I wasn't even working for the exchange. So they're really great, and they're community people. These brokers, they work in the community, they participate in the community, they understand the needs of the small business owners and the individuals in the community. We also have other alternative options to enroll. We have a call center. If you visit us at www.accesshealthct.com, you can find our call center number there, and you can call in to check on your application or to start the enrollment process. Another thing I wanted to bring up is, watching the national news, there's a lot of convoluted information going around. There's a need to differentiate ourselves from the federal health insurance exchange, healthcare.gov. for the pure fact that what's happening on a federal level doesn't necessarily affect what's happening here on a state level. Fortunately for us, we were able to start our exchange on a state level with local people and understand the needs of the Connecticut residents.
Right.
One of the things on the news recently was regarding the cancellation of the shop, which doesn't technically affect Connecticut. The shop is still full in force in Connecticut. The shop exchange is a program that affords small businesses the opportunity to receive small business tax credits based on the demographics of their business and how their business operates. Give you a quick example of how this would play out for a small business here in Connecticut. If you had a small business with under 25 employees and the owner of that business contributed at least 50% of the total premiums for each employee for health insurance, and the average salary of the employees was under $50,000, excluding the owners of the company, the business owner could be potentially qualified for up to a 35% small business tax credit toward his contributions. It could be less than 35%. It's based on the incomes and the demographics of their business. But we do have a great team working with the shop. Their website is www.accesshealthsmallbiz.com, and you can go there and find the phone number and also find the numbers to some local insurance brokers to help out with that. So going back to the individual exchange, which we operate out of Hartford, we also have storefronts available. We have a storefront in New Britain on Main Street, and we also have a storefront down in New Haven on Crown Street.
Right.
So those are great opportunities for people to walk in, sit down with a licensed insurance broker or a navigator in-person assister, and get some help understanding how to input their information, how to pick out a plan, having a broker go over the benefits and helping them understand the co-insurances, the co-pays, and the other things that are important with their health plan. We also have enrollment fairs, as Michael was talking about. We have a great enrollment fair tonight. We're expecting some good participation. We have good coverage. We have brokers coming out to help people out, and we're really excited about that. So there's really no wrong door. Any way to get in is going to be good for us and good for everybody.
Okay, so what we're going to do now is we're going to plug the sponsors. We're going to take a quick break. We'll be back in a couple minutes. Thank you for listening. Healthcare and You today.